A leading neuro-radiologist from India talks about CCSVI, a new experimental treatment for multiple sclerosis. The doctor has over 50 scientific publications, has fellowships from France and Paris. He is also a visiting professor at the University of Massachusetts in Boston.
I am a trained interventional neuro-radiologist, and my 100% of practice now focusing on neurovascular procedures. And we treat brain aneurysms, brain arteriovenous malformations, we do thrombolysis in acute stroke, we do carotid or any other brain artery angioplasty as well. And other procedures such as we do liberation procedure for CCSVI for patients in MS, which is an ongoing study in our institution. I was trained as radiologist, and then I was trained as neuro-radiologist, and I became faculty in All India Institute of Medical Sciences, which is one of the most premier research and teaching institutions in our country. After working there as faculty, I resigned, and now I'm part of where I head the interventional neuroradiology unit. I've done short-term fellowships abroad, including in clinic as well as in France, in Paris. And I've got over 50 publications, including 30 international publications to my name. And I'm a visiting professor in University of Massachusetts in Boston. Mainly I focus on neurovascular procedures. So we do embolization for brain aneurysms. We do embolization for brain arteriovenous malformations. We do angioplasty for carotid artery or intercranial angioplasty for intercranial atherosclerosis. We are also doing thrombolysis treatment for acute stroke patients. Besides this, we also do tumor embolization, vertebroplasty, and there's a big study going on in our hospital for liberation treatment for the CCSVI in patients with multiple sclerosis. So we have been doing quite a few of liberation procedures as well. CCSVI is a newly proposed disease entity in which the theory is that there are some venous narrowings in the veins draining brain and spine, and they are contributing to multiple sclerosis or actually worsening the multiple sclerosis patients. And the proposed hypothesis is that once we do angioplasty or stenting of these veins and we improve the flow, then these patients can benefit. And this procedure is known as the liberation procedure. So in this procedure, we do a complete evaluation. We have a team which involves neurologists who focus on multiple sclerosis treatment, physiotherapist, neuro-radiologist, and of course I am the neurointerventionist. So we do a complete neurological evaluation, brain Doppler study, neck Doppler study for the veins, MRI of the brain and the MR venography, and then the angiography for the brain veins, which includes jugular veins and azygous veins. And if we find narrowing, then generally treat them by angioplasty. And then of course we do as a follow-up, again we do Dopplers to look for the improved flow, and then we are following up these patients whether they really benefit from this procedure or not. There is tremendous interest in the patient community as well as in the medical community in this disease entity. All of us know that we didn't have a really definitive treatment for multiple sclerosis, and which strikes patients in the prime of their life, and generally it's a progressive disease. After studying many patients, I feel that there seems to be some link between multiple sclerosis and these patients many patients we are finding venous stenosis in them. So I think there is some link. But we are also guarded in saying that definitely this is causing, because I think we should wait for the more longer term studies. But I think under a study protocol, this can be offered to the patients suffering from multiple sclerosis, provided they understand that we are still awaiting long-term trials, and long-term results will take few years for us to be sure about long-term results.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.